I'm Dr. Anita Sharma. I'm a lactation consultant at Fortis La Farm and working with Amara. My request is that feed your own babies, and if you have surplus, do not waste any precious breast milk. It is like gold for us. Donate it. So it's a gift that only you can give so that we can save other little babies who are very dependent on your milk. So my message to everybody on World Milk Day is that milk is species specific. A cow's milk is for cow's baby, an elephant's milk is for elephant's baby. Similarly, human mother's milk is for little infants, for little babies. So please nourish your babies for the first 6 months by exclusive independent breastfeeding. The thing is that nobody needs to teach you how to breastfeed. It is a natural instinct which the mother and the baby have. Just get the baby close to you and they know what to do. They will start breastfeeding. Nobody teaches anybody on the street how to breastfeed. It is just a natural process. Because of this, that we want all children to have mother's milk, and especially our preterm babies, where even for a day we do not want to give any baby formula milk. We have recently launched the Amara Human Milk Bank Foundation, where we try and provide milk for every little baby, especially the preterm babies where the risks of infections etc. are very high, and it is perfectly made to suit a new baby.
On the occasion of the World Milk Day, we wish best of luck to all the mothers to try and breastfeed the baby as much as they can. Mother's milk is the best milk for all babies, whether they're born at term or at preterm babies. There is no substitute for mother's milk in this world. Every mother should make every effort possible in this world to try and breastfeed the babies. We as a doctor fraternity as well as a pediatric facility, we always try and get more and more mothers to breastfeed the baby, and we explain to them the importance of the mother's milk. More so as neonatologists who look after preterm babies, even in these very vulnerable babies, mother's milk is the best milk for the babies. It is for this reason that in most countries, wherever there is a neonatal intensive care unit, we try and establish a milk bank. A milk bank is mainly established for these very preterm babies, where donor mothers, mothers who have excess amount of milk after they fed their own babies, can express their milk and voluntarily donate it to the bank. In the bank, we process this milk and then we use it for these vulnerable babies once it's been pasteurized, which means any form of infection, if there is any, would be removed by this process. So we established Amara, which is the breast milk bank, first of its kind in Delhi, and we like to cater to everybody across Delhi for all the NICUs where vulnerable babies are being born and they need mother's milk. A lot of time in these babies, mother's milk is not available. Mother's milk is very important for these babies, not only in terms of protecting them from infection, because there are a lot of anti-infective properties in the milk, which you do not get in the formula feed, but it is also best tolerated. That means the baby can digest this milk better than any of the other formula feeds or commercial feeds that are available. In terms of formula feeds, babies can have problems. A lot of them have feed intolerance, some of them get lactose intolerance, or whenever this milk is given, they get other problems like rashes. Sometimes they get blood in the stools. To avoid all these things and to keep it simple, it's always better to just try and do what nature intended us to do, which is to breastfeed the babies. And it is with this view that it is very important for all mothers to make 100% effort to try and breastfeed their own babies. And we as the medical fraternity or pediatric fraternity will try and help them as much as we can from our side. But it is imperative that all mothers try and breastfeed the babies as much as they can.